Hello, this is Patricia Kovacevic, General Counsel and Chief Compliance Officer at Nicopure Labs. Today we're talking with Professor David Sweanor, a prominent attorney, lifelong anti-tobacco advocate who's also a tobacco harm reductionist. David, can you please tell us a few words about yourself and your work in the area of tobacco harm reduction over the last few years?
Sure. Well, I've been involved in doing things to reduce smoking since the beginning of the 80s. In Canada, we were very successful with a lot of those things, which caused me to then do a lot of international work with the World Health Organization, World Bank, et cetera. And it became really obvious by the early 90s that if we didn't deal with the product itself, we didn't deal with the fact that people smoke for the nicotine, but they die from the smoke, we weren't going to get nearly as far as we should in terms of reducing the health burden. So I started writing more, doing more, speaking more on issues of risk reduction, because this is essentially a really, really simple issue, that we've got a tremendous number of people dying, not because of the drug, but because of the delivery system. And anywhere else, we say, change the delivery system. There's reasons that we deal with things like clean needles, or we deal with condoms, or auto safety. We change something in a way that deals with the underlying risk, without necessarily having to immediately change the behavior associated with it.
Correct, and Canada indeed has had some successes in tobacco control. However, as we know, Canada hasn't quite embraced what is probably the biggest leap forward in tobacco harm reduction, which are actually vaping products. In fact, according to Health Canada, you need a basically pre-market authorization as a drug as soon as you contain nicotine. And yet, e-cigarettes are widely available for purchase in Canada, albeit arguably illegal under the federal regulatory regime. What's happening there, and when is that going to change?
Sure. Well, in terms of where we are, one of the problems was conceptual, and I've dealt with this all my career. When you talk about, getting restrictions on tobacco advertising, and government bureaucrats would say, but we don't have any laws that do that. I said, well, see, that's why you need a law that does it, and that's why I'm here to talk to you about law reform. When they were dealing with nicotine, their view was, if it's got nicotine in it, then under our law, it's either a tobacco product or a pharmaceutical product. And since vaping isn't a tobacco product, well, then it must be a pharmaceutical product. Without saying, well, this is like somebody who's told to take shapes and divide them into piles based on whether they're a square or a circle. But then they get to a shape that's a triangle. And they say, well, okay, it's not a square, so it must be wait, it's not a circle, it must be, oh my gosh, what am I going to do? So they took this position that it must be a pharmaceutical product because it's not a tobacco product. And of course, it isn't. So you had bureaucrats who said, we're going to treat this like it's a medical device or medical product. It clearly wasn't. But them saying that it would be illegal to sell anything with nicotine in it, we had this proliferation of vape shops, independent companies that said, we're saving lives. This makes sense. We're going to do it. And they were backed by those of us who were saying, constitutionally, we have a constitutional right to life. We've had our Supreme Court defend things like safe injection sites for IV drug users, because you've got people who are dealing with a dependence, and they're being forced otherwise to deal with it in a way that's far more hazardous. So our Supreme Court of Canada has ruled on IV drugs, it's ruled on marijuana, that people are entitled to access to a safer alternative. So one of the problems is that bureaucrats saying this is our interpretation of the law, but when challenged, the vape shops that were onto this were just sort of saying, you're wrong. For something, as as a lawyer, to say, I think this law makes something illegal doesn't make it illegal. A bureaucrat can say something, but have they interpreted the law correctly? Is this the right law to apply? And what's the Constitution say about this? And as a result, they haven't been willing to enforce the law. So we've had this proliferation of hundreds of vape shops, hundreds of thousands of people are vaping. And Health Canada was frozen trying to figure out how to deal with this, because of course you intervene and try to shut these places down. And number one, you don't have enough inspectors. Number two, even if you succeed, you've added to the health problem rather than reduced it. So they've now said, we're going to introduce a new law. So they're going to introduce a new legislation in the next few days that is supposedly aimed at facilitating people quitting smoking by moving to vaping, while trying to deal with unintended consequences like young people taking up vaping.
Do we know if this law is going to involve any requirement for a pre-market review, anything similar to what's in the US?
We don't know. We would hope, I mean, Canada's generally, I mean, this is from a Canadian perspective, we're generally a lot more sensible to some of the stuff that happens in the States. The FDA law has really harmed public health. For an agency mandated to protect the health of Americans, they've ended up with a law that really protects cigarettes and makes it much harder for people to be able to move to alternative products or for the companies to bring out something. And in a context where we know that virtually all of the harm is the delivery system, all of the harm is the smoke, they've made it harder to move to the smoke-free products. I mean, that's just abysmal. I can't imagine Canada's going to do that badly. So we'll see what they do, and it's that trade-off between, are we really going to focus on all those millions of smokers who want to quit and they need viable options, and total nicotine abstinence, this whole quit or die thing, is wrong. We can help them move. We can get the market to work for us, the way we've historically done on food regulations and pharmaceutical regulations, and automobile regulations, et cetera. Because if you don't do that, you end up perpetuating the harm among the people who are at great risk. But if they focus too much on things like, let's be absolutely certain that nobody who doesn't currently smoke could ever use one of these products, what you're doing is you're condemning another million Canadians to a premature death from smoking in the next 25 years. I mean, that's what we're going to get. So it's that trade-off between those. And they have to deal with those of us who are making what I think is a very logical public health argument about maximizing health gains, and those who have an absolutist ideology. So more like the Anti-Saloon League in alcohol, saying, we just have to get everybody to quit using nicotine in any form. So they have to deal with those competing interests. And of course, as a proud Canadian, I'm going to say, I think they're going to be rational. I think they're going to come up with something that's actually good for public health. But we'll see in a few days, and by the time this goes to air, I could be proven wrong.
Well, we will definitely debrief that new piece of legislation with our audience as soon as it comes out. It's interesting. Canada is a Commonwealth realm country, of course, and it shares a queen with the United Kingdom. So what are the chances that the Canadian government, once this new piece of legislation is adopted, will actually engage in active communication of comparative risk of vaping products to the audience, much like the UK through Public Health England is doing, and through smoking counsellors, as you well know. In the UK, smoking counsellors, in fact, are now directed to communicate the potential benefits of vaping to those smokers who otherwise cannot quit. Sure. Do you think Canada might be looking into that direction?
I certainly hope so, and I think it's quite likely. If you look at the history of it, on so many things, Canada is sort of somewhere between the UK and the US on issues. And the US has this history of being very absolutist, that if you look at alcohol prohibition.
Baptists and bootleggers.
Yeah, that's right. Yes. The war on drugs. The view on tobacco, if you look at the underlying goal of major US government agencies, it isn't to reduce death and disease. It's a tobacco-free America, the way it was a drug-free America. We've seen how that works. Or no sex outside of marriage sort of thing. So, I was just in Charleston. The front page story in yesterday's newspaper was about abstinence-only sex education in the schools. And
in this day and age, it's a little bit unrealistic, one would say.
Well, I mean, from a Canadian perspective, you look at that and you think, am I reading The Onion, right? This is done as a joke. But it's not done as a joke. I mean, people really believe the only thing you should tell young people is don't have sex before you're married. Let's ignore the fact they're already having sex. Let's not tell them about reduced risk. That isn't going to happen. That sort of stuff doesn't happen in Canada. I think we have a much more British orientation of saying, let's be pragmatic, let's be reasonable, let's meet people where they are, let's look at what we can do to actually have an impact. And I think bodies like the Royal College of Physicians in the UK, which is probably the most prestigious health body in the world, a medical body in the world, and it's being ignored in the United States. You have the Centers for Disease Control here that it's got a mandate to protect the health of Americans that's actively misleading Americans about their leading cause of preventable death. I don't think that would happen in Canada. It certainly doesn't happen in the UK. So I think if we had to choose between those models, we're much more likely to go the UK route, in part because we do have people be pushing the constitutional angle on this to say, it is just simply not only wrong to actively mislead people about things that can result in their deaths, it's illegal, it's unconstitutional. We'll challenge you in the courts. So I think we have a chance of getting something done, and to the extent that the vapers themselves start to speak out, because I think it's a matter of them getting voice on this. It is really hard for those who are pushing an abstinence agenda to deal with that when the actual people whose lives are on the line start speaking out. And we saw that with things like AIDS, that once you started getting the community at risk to get voice, to speak out, politicians had to change. Even in the United States, politicians changed. And I think that same sort of thing could happen here. We have enough users that they're starting to get angry about this. And I'm a great believer in rage. You want consumers to get enraged at things that a government is doing. And I think in Canada we have a chance for something fairly pragmatic. I think it will develop over time, but we're going through a major transition here. And I don't think even crazed government policy like what we see in the United States from the CDC and Frieden just, actively misleading people. I don't think you can stop it, because information is being shared on the internet. It's being shared through social media. People are getting truthful information, and they will get angry. They will get angry at politicians and so-called health officials who mislead them. They will get angry about an FDA law that's protecting the deadly product while putting huge obstacles in the way of the less hazardous product.
So what you're saying is basically because of the power of the internet and communication in today's world, FDA and the US are going to become isolated, the outliers. Everybody will know, in fact, that the whole rest of the world, or at least some very meaningful countries, Canada, the UK, and other European countries, are seeing the benefits to public health that the products result in. And at the same time, the US is sort of digging in their heels and really not taking action, not communicating comparative risk. In your opinion, bearing in mind that regulatory hurdles are really very high in the US and not so high elsewhere, how do you see this market of vaping products evolving in the next few years? Not the ideal scenario, but the realistic scenario. And there'll be one evolution in the US for sure and another one overseas.
Yeah, well, I think part of it is things like your legal challenge against the FDA law. You're on very strong grounds. If the courts move on that, we've defeated this legislation that is really harmful to health. So the US is sent back to have to rethink this, and it could force them into doing something that is consistent with the long-term history of the US on these things of actually getting it right, of facilitating the change to less hazardous products. Like we've seen on environmental issues, we've seen on automobiles, we've seen on pharmaceuticals, we've seen on foods, we've seen on industrial equipment. Just so many things. So I think that's quite possible, and I think it's very much to your credit that you've done the challenge of that legislation. It is brilliant. I don't think FDA can come anywhere close to answering the concerns that you have raised, because they simply don't have the grounds for doing it. So, but if for any reason the U.S. manages to push forward with this sort of irrational "let's protect cigarettes" approach, I also believe in my experience in decades of working on public policy issues is that good policy is contagious. So when the Americans start seeing what's happening to smoking rates in countries that have been open to alternatives to cigarettes, it's really hard to ignore. To say, had we done that, far fewer people would be dying now. Had the United States simply told the truth about smokeless tobacco compared to cigarettes? It is amazing that 90% of Americans don't believe there's any smokeless tobacco product that's less hazardous than smoking cigarettes. The difference is enormous. They've been fundamentally misled. I think as that information comes out, there'll be anger about that. That's the sort of thing that causes the status quo to crumble. It causes this whole abstinence-only thing to be shown to be, immoral, unethical, illogical, and I think it could trash it. But in the absence of that, just seeing what's happening in the rest of the world, it's really hard to ignore it.
And we really hope that will translate into grassroots movements here in the U.S. And in fact, as you know, Nicopure Labs is on the board of the Vapor Technology Association. One of our priorities at the Vapor Technology Association is, of course, to work with Congress and Senate to change the grandfather date at least to protect some of the existing products that were on the market as of August 8. We believe that to be a very valid initiative, and it will unfold in the next few months. And that probably is the key to solving part of the problem with the regulation. The other thing that we need is really, David, people like yourself, like Clive Bates, like Chris Russell, scientists from all over the world, to really take the time from their busy schedule, from your busy schedule, as you're already doing, and thank you again for that, I cannot thank you enough, to go and speak with FDA, but more importantly, speak with legislators, because FDA seems already to have taken the approach that they cannot do much, they're limited by what the statute requires, and therefore, honestly, we have to change the statute. So it's, again, very important that you engage as much as, yes, it's not your country, but I do think it's our planet. And more importantly, it's the future of our children that really have to see inevitably a reduction in smoking rates if we care for their well-being.
I mean, it's one of the reasons many of us who are involved are so involved. This is actually a really simple problem, you know, that it's the smoke. You get rid of the smoke, we solve the problem. We're looking at WHO telling us, based on the status quo, if we continue just doing the sorts of things we're doing, 1 billion people are going to die in the next 100 years as a direct result of cigarette smoking. That's the status quo. How can anybody think that that's acceptable? Because, you know, even beyond things like disease eradication on smallpox or polio, or what we've done to dramatically reduce the risk of death from automobile accidents, et cetera, when you deal with tobacco, when you deal with nicotine, we know that we could reduce the risk probably by well over 98% really, really quickly through really simple things like facilitate new products getting on the market, tell consumers the truth about those products, have things like differential taxation, the things I've written about in the New England Journal of Medicine with Frank Schlupke and Ken Warner, differential marketing, give people an incentive to move to those less hazardous products. You know, economic incentives, informational incentives, incentivize companies to come up with better products. You know, the United States is really good at that. If you look at the 1938 FDA law that brought forward science-based products that truly did deal with issues that the snake oil products, the patent medicines didn't. And within 12 years, like just 12 years, 90% of the pharmaceutical products sold in the United States were products that didn't exist before that law. So what if the FDA, instead of saying, we're going to get in the way of alternatives to cigarettes, said, we're going to facilitate alternatives to cigarettes, like we did in facilitating the movement to sanitary production of food products in 1906, like we did with science-based pharmaceutical products in 1938. We are going to facilitate these changes. Imagine what would happen. Imagine the release of human ingenuity, the capital, the scientists to come up with ever better products to meet the needs of ever more smokers. How rapidly, you know, you take a $100 billion business in this country of cigarettes, and most of the users are already saying, I don't want to do this. Give them an alternative. I mean, it's a slam dunk. We just have to start doing it. And globally, it's an $800 billion business. Imagine, you know, that people could make billions of dollars creating thousands of good jobs doing something that solves the biggest epidemic we're currently facing.
And saves lives.
Saves lives, meets consumer needs. You know, if you look at things like, you know, what was the leading cause of cancer death in America in the 1940s? It was stomach cancer. You know, why was that? That was because of diet. You know, it was because of highly smoked, pickled, salted foods, foods that went bad, you know, people continuing to eat food that had been sitting out on a stove for days. They didn't have refrigerators. And ice boxes didn't work very well and they were very expensive. You could have had a campaign to make people feel crappy about the food they were eating, but they didn't really have a choice. And instead what we did is we had technology. We had entrepreneurs, we had business, we had a market intervene with something called refrigeration. And because we could now ship food in refrigerated rail cars, and people could keep food in their homes in refrigerators that they could pay for and cost less money than having an ice box. And diets changed. And in a short period of time, stomach cancer went from being the leading cause of cancer death to being mercifully rare. And it didn't require government expenditure. It didn't require, yelling and coercing consumers. They already wanted to change their diets. We just had to facilitate it.
And now we're seeing a similar revolution with vaping.
It's exactly the same thing.
However, it's industry generated, and it has the potential to change the biggest problem we're facing today.
Exactly, just the way refrigerator was. The refrigerator was a commercial response to a consumer need that solved the leading cause of cancer death in those days. We now have the leading cause of cancer death being lung cancer because of cigarette smoking, plus all the other cancers and all the other diseases caused by smoking. And these people, just like the people eating bad food in the 40s, are saying, I wish I didn't do this. We can give them an alternative. You give them an alternative, and then one of the truisms of public health is that many of our biggest breakthroughs have come from two really, really simple ideas. One, you give people enough information to make an informed decision. And two, you give them the ability to act on that information. You do that, we have a revolution. And they're really simple, we can do it now, and we would eliminate smoking in a fairly short period of time. We just have to have the imagination to say we're going to do this. We have to put it into place and recognize the absolute absurdity of saying we're going to deal with this by putting huge barriers in the way of the less hazardous products. And you imagine going back to the 1940s and saying, well, we get this idea of refrigeration, but we're not going to allow you to sell a refrigerator unless you get it approved by a government agency. And any refrigerator you come up with or any change you make to any existing refrigerator could take 2 or 3 years and cost you millions of dollars in order to get it approved. And we're certainly going to run campaigns telling people refrigerators are a really, really bad idea. I mean, where would we be? We'd still be dying of stomach cancer. We were sensible then, we could be sensible again. And if we do that, we solve a huge problem.
That's a very wise thought, and surely we hope this is the direction that FDA will eventually take when hopefully they start listening to what happens in the UK and now in Canada. Thank you, Professor Sweanor, for your time. It's always a pleasure, and thank you for watching us. Until next time, thank you.